All right, I think we're good. All right, I just started recording. I'm sorry for everyone's here. I'm just going to like quickly summarize and say it for the people that are going to be watching it back later. So tonight we're going to be having our presentation from Shay on Medicare, Medicaid, and just kind of his general discussion on the topics. We're also going to be talking about our service events that are coming up. We'll have info on the presentation that we'll send out through email, as well as on this recording, on kind of the date, times, the information on the service events. Just kind of like a general before we even start. There's going to be 2 next week, and then 1 kind of later on. So kind of just get that early prompting on, look at your schedule, see what's going on. But we'll move forward here. And this is kind of a general outline of today. I'm going to stop sharing. First, let me introduce our speaker for today, Shay, who is kind of an OG, an original member before SEAD was ever even really a thing. It was several of us that kind of were in that transition stage between the previous club and this club. And then he was also the vice president last year, was able to organize several of the speakers and kind of the ideas that circulated throughout the club. He's a great addition, and he's kind of that standing, kind of that image of a person that didn't take the conventional route to dental school, but is still there at the end of the day, taking his own route. He's got a very interesting journey. If he ever does want to share, you want to reach out to him, I'm sure he'd be happy to. But let me leave it up to you now, Shay. Let me stop sharing. Go ahead.
Okay. Hi, everybody. I'm Shay. Yep. I was a member of SEAD up until last year, or last year. I'm a D1 at OSU, obviously, I guess. Yep. Feel free to reach out if you have any questions about the application process. You want me to read applications. If you want to know what dental school is like. It's not hard. I think you guys are probably all better students than I am, so I think you'll probably have an easier time and be a little bit more invested in it. But it's not super bad if you stay on top of stuff. And also have a background in science, which I do not. And I realize how helpful that would be if I had taken like a neurology class or more than one anatomy class. Anyway, okay. So I gave this presentation last year. I'm updated it very slightly for this year. First of all, can you all hear me? Sorry. Okay, cool.
Yep.
So I'm just a brief overview of Medicare and Medicaid. I don't know if you've experienced that doing your shadowing. I don't even know, is shadowing happening now because of COVID? I don't know. But going to different offices and clinics and seeing the different patient populations and how those offices handle Medicaid and Medicare patients and people with private insurance or people who are just paying out of pocket. I don't know, it got me really interested, and I never really had a strong background in knowing what Medicaid and Medicare was. So I just did some research and have been looking at it over time to guide like my future career. So this is kind of just like a really quick synthesis of that information. So hopefully we will make this fast and not super painful and boring because it's a lot of numbers. Okay. Boop. Okay. Can you see that?
No.
Nope. Okay. Oh, I need to do screen share.
Yeah.
Yeah, sorry.
I'll let you know when it pops up.
Here we go. Woohoo. Okay.
You're all good.
Okay. View full screen. Okay. Can we see that? Sorry, my computer's like giving me some weird things. Dental care and social safety net.
Black.
Yeah, it's a black screen
You
now.
could see the second.
Sandwiches. Okay. I think I need to leave and come back.
Well, when you had it not full screen mode, we saw it.
Oh, okay. Then we will just do that.
Yeah. And it was still pretty legible. It was pretty easy to see things.
Okay. So I'll just cover up all you people. Okay, cool. So we can see dental care and the social safety net.
No, not now.
Ah, come on, man.
So
Okay.
earlier when you had it, like when you initially press share and you're like, oh, let me go to full screen mode now. Like before you press that full screen button, it was good.
Okay. Like that?
So we see it now, mostly. Yeah.
There we go. Okay.
Yeah, it's good.
It's only been 7 months, still have not figured out Zoom. Okay. I have a funny story about that if you'd like to hear about it in the later. Um, anyway, so dental care and the social safety net. Whenever I talk about it, I'm always like, it's kind of boring. It's also a major bummer, but it's something super important that we need to talk about more as future healthcare providers. So, in my free time this last application cycle, I did a lot of reading and reviewing people's personal statements because I really like writing, and I also was just kind of nosy and wanted to learn what other people were writing about. So I highly recommend, if you are writing your personal statement for this next cycle, just get on to the like DAT bootcamp and just take anybody's who wants help writing or like reviewing their personal statement to read them and give them edits and like maybe inspire your own, or also see what everybody else is writing about and maybe like avoid some of those cliches. But in like 90% of the essays I read, people almost verbatim wrote the phrase, I love science and art and I want to help people. And I always thought that was really interesting because while we do want to help people as dentists, it is very hard to help people in the economy that is set up for us as providers, because a lot of American citizens do not have health insurance, period, but even fewer have dental insurance, which is its own like thing outside of health insurance, and makes it difficult to provide that care. So when I say Medicaid and Medicare, for the longest time, I always just use those words interchangeably because they sound very similar, and I didn't realize there was like a big difference for them until I heard a podcast and they came up with this little mnemonic. So when we talk about Medicaid, what we're talking about are people who are poor, who make under a certain level of the poverty line. So they always say Medicaid, underpaid. So when you think Medicaid, you're like, oh, this is somebody who maybe has a disability or is not working, but is in that like working age population. And then Medicare is something that's provided to all people over the age of like, I think it's 65. So when you turn 65, you are automatically enrolled in Medicare. So when you have gray hair, you get enrolled in Medicare. And so the numbers that Medicaid and Medicare cover are crazy. 37 million adults, and consequently a lot of kids, so 35 million kids are covered by Medicaid, and 55 million people over the age of 65 are covered by Medicare. Also, I just added this. I lost all my colors, so there's gonna be some wonky colors in some of these slides. CHIP is a like auxiliary insurance program for children. So there's Medicare and CHIP. I think CHIP covers like 10 or 15 or 20 million kids, but it's a specific partnership between federal government and state government to provide healthcare for children. But when you think about all of America, there's like about 330 million Americans when I Googled it last year. So when we like take out the number of Medicare and Medicaid, people who are covered by Medicare and Medicaid, you know, it makes up almost a third of the US population. So these are people who are underinsured who don't have insurance. and make under a certain amount of money in the case of Medicaid, or over the age of 65 in Medicare. So a third of Americans are covered by these social safety net programs. And then the question is, cool, well, what do they cover for dentistry? And the answer is nothing. By law, at least at the federal level, Medicaid and Medicare are exclusively for health problems and their health insurance. And as you may or may not be aware, there's this weird disconnect between dental care and health care. They are not covered the same, which is really messed up because, as we'll see later on, dental care is directly tied to people's health care. And it is something you will fight for the rest of your career, because even now, when I tell people I'm in dental school, they do not think I'm smart enough to become a doctor or like a physician and other things, and I have to explain a lot of what all of this is about. So even though Medicaid and Medicare do not actually cover dental things, the states have stepped up to provide their own ancillary coverage for dentistry. So depending on the state you live in, depends on the level of state-funded dental care you can receive. So I think that's kind of important to think about. Ohio has pretty good dental care. There's a per person cap of about $1,000, but you can see a lot of other places offer no coverage or only emergency pain relief if you show up at the ER. And so that kind of depends on the reimbursement rates you get as a dentist. Things like that. So when you're thinking about where you want to practice in the future and you want to help people, you could be like, oh, I'm going to work these places where there's no coverage and help the most desperate of the desperate. Or you could also be like, hey, I'm going to go look at one of these places that has like pretty good extended dental care in the state and work there so I can maybe service more Medicaid or Medicare covered patients and still, pay back my student loans and stuff like that. So I don't know, just something to think about if you do not necessarily want to stay in Ohio. So what does Ohio cover? You can look up on the Ohio Medicare and Medicaid page. I also have a PDF of all the reimbursement rates that I will send to Dakota, and he can put it in the SEAD box or whatever. So I don't know, and maybe you've seen some of this at places you've shadowed if they cater to a lot of Medicaid and Medicare patients. But with prior authorization, anyone younger than 21 who can show a need for orthodontics can get them with a $0 copay. If you're under 21, you can get free cleanings twice a year for a $3 copay. Also, if you're pregnant, they give you a little bit more coverage because when you're pregnant, that fetus is leaching all the vitamins and things out of your body, and so it really weakens your teeth. And for some, they realize that and give you extra dental care if you're pregnant. So if you really, really need dental care, just go get knocked up. Let's see, dentures, yep, $3 copay, pretty much a $3 copay for everything. The major things that they don't cover are medical, like surgical services, like getting like a root canal and things of that nature that require like anesthesia and stuff. This has come up a lot recently in our complicated political scheme of all this being socialism, that all these people are getting stuff for free. And I think it's just something important to keep in mind. I was at a barbecue a couple of weeks ago and got in this very complicated discussion about people getting free healthcare, and what does that look like, and what do they actually receive, and is it really free? We're going to talk a little bit more about that in the future, but just something to think about when people say socialism, talking about $3 dental care for people who desperately need it. So those are those $3 is basically the out-of-pocket costs for poor people in Ohio to get dental work done. But you know, the out-of-pocket costs and why people have insurance is pretty crazy for a lot of dental procedures. You know, it can cost $5,000 without insurance to get braces. You know, it's $100 to $150 to just get a checkup and cleaning if you don't have insurance. If you, in a previous job, I did not have insurance and would pay out of pocket for my checkup and cleanings. I thankfully had no cavities or anything, but you know, I still paying like $100 every 6 months just to get a checkup and a cleaning. You know, dentures are $2,000. Getting a filling just with no insurance can be $200. Getting a crown is $1,000 with no insurance. You know, a root canal is $1,000 with no insurance. So as a provider, like I would like those funds, but in addition to that $3 that the patient on Medicaid would pay you, you also get reimbursed from the state government, which doesn't necessarily match up with the costs of what those services you provide are. So, and this is in the PDF that I'm going to give to Dakota to send y'all. It's, you know, the state of Ohio will reimburse you $35 for a routine checkup or a cleaning. They'll reimburse you $50 for a filling. So if a filling costs you $100 and you're getting reimbursed $50, there's still a $50 chasm there, plus the $3 copay that the patient will give you that you have to make up somehow. You know, root canal is $1,000 and the state only gives you $400 for it. And then there's all these other complexities that come with Medicaid and Medicare patients. A lot of them don't have reliable transportation. And an office I worked in or shadowed in that catered to a lot of that population had a 40% no-show rate on the first visit for a lot of their patients. And they had like a 2-strike policy. If you don't show up the second time, we're dropping you as a patient. So, but that's still, if you have 10 people and 4 of them don't show up for a day, that's 40% of your revenue gone. And keeping in mind that being a dentist is stupid expensive, like not just the insurance, but running a practice. I was looking at the costs of running various practices, and the average was about $500,000 to almost $600,000 in overhead costs. So that's keeping your lights on, keeping your lease, paying your hygienists and FDAs and front desk people. So if you need $600,000 and you're getting only $50 to do a filling, you know, you'd have to do like 6,000 procedures a year to just break even. And that is a lot and too much to do. And that's why so few dentists actually accept Medicaid, Medicare, or CHIP patients. So this was, I got this from the ADA website. Less than 40%, so 39% of dentists participate in Medicaid or CHIP. And yeah, depending on what office you shadow in, you could see that. I shadowed in an office that had a strict no Medicaid patient policy. And I thought that was very interesting because I had always ever seen Medicaid and Medicare patient heavy clinics or offices before that. So, you know, 39% of the United States dentists as a whole see Medicaid patients. Only 33, so a third of Ohio dentists specifically see Medicaid and Medicare patients. So 2/3 of dentists in Ohio are like, we are not just even going to deal with it. Deal with the bureaucracy, deal with the no-shows. And that's problematic, I guess, because I mean, we're the 32nd lowest 32nd highest provider of dental care for patients with Medicaid or Medicare. Iowa has the most dentists who see to those kind of patients. So I don't know, we're not helping as many people as we should, I guess, if we're that low in the rankings. So, you know, helping is hard. And I don't have a great answer for how we can fit. Well, I have one great answer for that. It'll be coming up in a second. In Ohio specifically, the outcome of the fact that there are only 33% of dentists who want to see patients without health insurance is that almost 84,000 of them in 2011, which was the last year I had numbers, showed up to the ER, because if you don't have insurance, that's where you end up, because you wait until your caries get super deep, until you get an abscess and your face gets all bloated, and then that's when you show up to the ER. A lot of whom don't really know how to cater to or who cater to dental issues. A lot of them just prescribe them painkillers and send them on their way. And back to that socialism thing, a lot of people are like, well, we can't afford to just give everybody dental insurance and dental care. And I'm like, yeah, but at the end of the day, between 2008 and 2010, we ended up as a nation spending almost $3 billion on ER visits for people who didn't have dental insurance, who just had pains that they couldn't get taken care of, or bleeding of their gums, or any number of things. So we could pay $50 extra for people to get cavities filled, but instead we're spending almost $3 billion at ERs that is never going to get recuperated, because the people don't have the money for it. And this all comes back to like this headline story that I heard about all the time when talking about the negative outcomes of lack of coverage in dental care for Medicaid and Medicare patients. Does anybody know who this little guy is? Oh, I can't hear anybody. Okay, so this is Diamante Driver, who Diamante Driver in the early 2000s was he's a Maryland, he's from Baltimore. He was, second or third grader, and he had a abscess in his mouth because he had an infected tooth. His mom didn't have insurance. She was on Medicaid, and at that time, Maryland had one of the lowest number of providers of dentists who took Medicaid patients. And for months, she could not get him into a Medicaid dentist. And so his abscess kept getting worse and worse and worse. And eventually, the bacteria came into his bloodstream, went into his brain, and they had to do brain surgery because his blood vessels got too inflamed. They had to remove some of his lobes. They had to part of his skull. It was crazy. But anyway, he ended up dying because his mom couldn't come up with, $80 to get that tooth pulled. And there were no dentists who could provide care for him because the reimbursement rates were so low that very few dentists wanted to take Medicaid patients. In addition to having troubles getting to and from appointments because she didn't have a car. But there's a bright side to that. because when that news broke about what happened, the legislature got involved and rewrote all of Baltimore's Medicaid policies and became one of the leaders in providing dental care to kids. So I think the law is actually called like the Diamante driver law that does in school dental screenings and stuff. But again, that's only Maryland. There's 49 other states that have similar coverage for kids. So there's probably dozens of Diamante drivers that we don't hear anything about. So that was a major bummer town. So what can you do about that? This is the book I always recommend to people where I got a lot of that information from. It's called Teeth by Mary Otto. I think it tells the story of dentistry from the early days of dentistry, which actually started in Ohio. And Bainbridge, Ohio was the first American dental school. If you have a free weekend, go check it out. It's pretty interesting. You see the rocking chair where the first like guy who taught dentistry in America like saw his patients, and the patients and the students that he taught went on to found the first two dental colleges in America, in Cincinnati and Baltimore, and led to the bifurcated healthcare system we have now, because they were the reason that dentistry was not included in medicine back in like 1823. I know, it's a great read. And also, yeah, a lot of the numbers and how Medicaid and Medicare works and how the impact of our two-tiered healthcare system for people. I gave a copy to Dakota, so maybe when he's finished with that, he can pass it along to whoever else wants to read it. Yeah, so anyway, being political again. So I want people to have more and better healthcare, especially dental care. I think it's important when people call it socialism to refer to them more as a mixed economy with funding for social services, which is really what we're looking for. I know it's kind of unfair that some, when I'm working and I have to pay for insurance and someone else gets it for free, but the positive outcomes for us as dentists is that hopefully that means the government will pay us more to provide that service and care for patients. Maybe they will do a better job at lowering our tuition so we can actually have the wiggle room to not need to take on non-Medicaid and Medicare patients to pay back our student loans, things like that. So think about that when you're voting this year and also in the future. Be a little bit selfish, like who would be great for me? What would be great for me as a dentist? Who would be good for my patients? And if my patients are good, that means I will also hopefully have a better life and be happier and be able to help people. And also talk to people about dentistry. A lot of people I feel like don't come into contact with dentists a lot. And I feel like it's important to talk about what it is like to do that job, and that you're not just in it to get a Porsche and work 3 days a week. Or maybe you are. Talk about that too. I'm sure people would like that. But bringing that human element of you as a medical provider, as a healthcare provider, and a person who is trying to help other people. So yeah, talk about that health stuff. Talk about increasing funding for Medicaid and Medicare instead of cutting it like they are doing now, because I want to help people, but I also need to pay back these loans, and hopefully you will all too. Cool, that's the end of it.
All right, thank you, Shay. Thank you very much. I guess I'll just open it up to kind of like a discussion. We can talk about like, well, first, if anyone has questions to ask Shay, or just kind of like put questions up in the air and anyone can answer. I'll leave you guys like think about it a little bit, but I have like a couple of things I want to say based on what Shay said and some like questions to put out there too. So like it's really cool because like I work in the endo department at OSU on the fourth floor of Postal, and like seeing the price ranges for some of like the endo treatments there, like that's pretty accurate. Like an endo treatment or an apicoectomy or a root canal is generally around like that $1,000 mark, a little bit under sometimes and a little bit over. It's just kind of like an average. Um, but the problem is that when you see that one number, it's like, well, I mean, for one person during their lifetime to maybe like at the most, let's say for root canal, stay on that. They only have to pay, I mean, let's say they keep their teeth generally healthy, hygienic. They need like, let's say two in their lifetime. That's only $2,000, right? Well, not really. When you consider the structure of the practice you're going to, whether it's a private or public practice run by a school, there's going to be slightly different charges for just kind of like that eval or examination before anything's even done. Additional costs for cone beam CAT scans, if any of you have shadowed and seen those. They're like kind of the big machines go around your head, take super in-depth x-rays of like pretty much your whole skull. Um, those usually run up the costs. Just basic x-rays and going into the dentist chair can sometimes be a cost depending where you go. And then the worst case scenario where, you have to go in for a retreat or the end of that they did on your tooth didn't go too well, which I've seen in person. They're gonna have to come back for multiple appointments, possibly do surgery on a tooth that didn't do well, or do a retreat, which might in certain cases be a couple $100 more. So there's kind of like even behind the averages, and that's just for endo, but I'm sure it's somewhat similar, and there's similar like cases in that for most other dental treatments, to where like depending where you go, if things go bad or go well, the charges can always go up. They can sometimes go down. It's kind of like that averaging out kind of thing. But even for those averages, you kind of got to look behind, see the story of it's not just that like one-time expenditure. It's not as easy to pay as it might seem. Um, so like in the story with Demonte Driver, like you never really know how much people struggle to get money together for things as simple as cleanings and checkups until you kind of like look at the stats and look like how many tens of millions of people are on Medicare, Medicaid, how many people are uninsured, how many people, even though they have certain limited coverages, they don't see the best treatments that they could. They don't see as regular of checkups and treatments that they should. And that also comes down to like an education thing. In poor communities, you don't necessarily see the standard of education or just the access to the education they need to just know these basic things. What we think is basic, some people might consider kind of like fringe knowledge. I don't really need to know that. When's that ever going to come up? Until it actually comes up, and then they get sent to the ER. And like Shay was saying, and what I've kind of talking to dentists through shadowing and at work, the ER really is not the greatest place for you to go if you have a dental related problem. They generally will just kind of give you a medication, an antibacterial, something to kind of take the pain away and do a quick short-term fix, and generally not, unless you have like a really bad case and they have to like operate on you immediately, they generally won't really be fixing the root of the problem. And that kind of like feeds back into that loop of adding cost to where you're not really being helped. Then you end up having to go places to get help, and then that's extra money. It just compounds on itself more and more. So like, yeah, like Shay was saying, it's a super complex situation. There's no like perfect answer, obviously. um but yeah, I don't know if anyone had any other like insights or questions to raise.
Yeah, I have a couple stories or examples of this as well.
Hmm.
One of the dentists that I was a general dentist, and this was back in one of my more rural, one of the more rural areas of Ohio. So it's rural, it's north of Dayton, population under 20,000. But basically, I asked him point blank. I said, "Do you treat Medicaid patients?" And he gave the exact answer, and that was two large problems. And the first one was that the reimbursement was of super minimal rate. And of course, this dentist was probably in his late 50s, so he, a little later in his career. But one of the biggest problems that he had said was, when I first started out, I was, brief story, but this dentist actually went out to an Indian reservation for the first 4 or 5 years and treated a lot of patients because he's very passionate about it, about providing a service to people that have limited access. But that was the biggest problem, was that the reimbursement was really challenging as far as paying off his own debts and especially like what you said, Shay, with paying your overhead. And one of the biggest things that he had the issue with was were no-shows. He said early on in his career, he would try and have one day during the week where he would try and just completely fill the schedule with a Medicaid patient. And he's like, I would typically double book that entire day, double book it, and that was essentially just so that he could have it filled in, because there was such a large amount of people who didn't have transportation or didn't have some means of even just getting to their own of getting to their, well, basically getting this treatment. And that it's such a complex problem, because he obviously was very passionate about wanting to address this, but there's so many complexities to it, and that was just really interesting to me. Well, I mean, it was just interesting to me that I was able, in one of my job shadowing experience, I was able to get a relatively brutal, like a point blank answer on it, because that's. But I was going to say the other example I had was, I mean, I even had this was more recently, and I don't know how much COVID had to do with some of this, but essentially she needed to get her wisdom teeth taken out, and of course she's on Medicaid, or she's on like her family's plan, or I'm not super sure on the specifics, but for lack of better terms, she had such a tough time finding an oral surgeon that would even accept it, that I think she ended up driving like an hour and a half to even, like, I think down to like Cincinnati just to even get care. And it was like 2 or 3 months down the line to schedule. And again, like I said, COVID may have played a little bit of an issue in that. But the other problem also was that the most astonishing thing to me was that she was in physical pain. Like, she was in physical pain, like, and that was the soonest they could get them in. It's like, yeah, 3 months or so. Hope you can get down to Cincinnati. And it's just, these are such complex issues that no one has some great solution for. But I think the most important thing to do is have this discussion about how we can address at least the problems, even in our local areas, or just, you know, what we can do to even make an impact to basically chip away at the problem, because it's very vast. And anyone that says they have a simple solution, they're lying. It's very complex.
Yeah, true. I kind of have like a couple things to, like, for what I remembered, I wanted to say based on what you just said, but I'll leave it open. Let someone else, if they have any questions or kind of things, maybe examples, kind of like what we've been doing, of like situations where they've seen stuff like this.
I don't have any solid examples, but I've shadowed 2 dentists, and I know that neither of them accepted Medicare, Medicaid. Now, I'm from Pennsylvania, where in that one chart, it was kind of on the lower end of things. But kind of like looking at that, even the good areas, like, it was pretty interesting to me that even though Ohio was considered to be in like the better range of places that offer care, they were pretty low on, like, they were far below the national average of like the percent of people who actually accept it, which kind of stands out, saying like what's considered good, like good care still isn't enough. So, and I have a question for Shay. Was the $3 billion thing, was that the cost of emergency care after people? Okay.
Yeah, so that was like so yeah, I mean, it's 2.7 billion, but like, yeah, I just keep rounding up because we're talking about billions, who cares? Yeah, so that was like the amount that ERs billed for non-insured dental patient visits, which essentially is the amount of money they had to write off, because if you're uninsured and hospitals send you a bill and you can't pay it, it's kind of like, yeah.
So it wasn't like the government was paying for it, or was it just like, how's that money getting, like, since you said that there was a gap between, like you said that if the government just offered a little bit better coverage, put more money into dental care, or like free dental care, like it would overall cost less money. So like, why hasn't that changed?
I mean, I'm not
You don't know,
political
obviously, but like,
expert, but like, I think they're talking to people again in Ohio, and again, this is only my personal experience. I like talking to people, and as a bleeding heart liberal person, and with a lot of associates in relatively like more conservative areas, I have these conversations a lot, and it's this fear of somebody getting something that you're paying for, or getting something for free. And yeah, I'm always like, well, I mean, if we tax me, I will give you an extra $100 if somehow that means we can reduce those ER write-offs. Because if someone can't pay those bills when they go to the ER, that just means the hospital has higher overhead at the end of the day. So everything just incrementally gets more and more expensive. And I don't know, that's why I'm very passionate about people who please just fund Medicaid and Medicare, and please do the dental care, because I just want people to live healthy lives. Because even like 3 weeks ago, I was going through the McDonald's drive-through, and I like gave the cashier my money. I was like, how you doing? And she's like, oh, I'm doing okay, but I got this toothache. And I was like, oh no. Just like, I know there's like a million other people just like you in this state, and I know you don't have probably very good insurance from McDonald's, and I know you're making like $13 an hour, and there's no way you can afford to just have an extra $300 to get that taken care of. I don't know, but also like, I have an MBA. I'm a business person too. Like, I want everyone to be happy and make money. So I don't know like how to get that balance correctly.
Yeah. I mean, you bring up a good point of like that kind of one of the main kind of deterrents of people to commit to like a Medicare, Medicaid plan that covers more and maybe costs more for like the average taxpayer is that like social stigma right now, especially right now, like in the election season with people's minds on it, just like we don't want to be associated with it. At least the country, it seems like, is super scared on like a totality basis of this idea, like you were saying, of just like people getting things for free that don't deserve it, and then people that are working hard for their money kind of like losing it for no reason. And like that's, I mean, that kind of like isn't, it's one of those things that's really hard to fight in terms of like advocacy, going to your local, state, and federal levels of government and trying to convince people to pass certain things. It makes it hardest when there's like a solid group of people that have their voices portrayed on media that they're just totally against it, almost no willingness to compromise. And that's why like for stuff like that, it kind of comes down to like these everyday battles of, increasing a small thing one at a time. And even though like in the short term, people are still hurting, people are still not getting access as quick as like the people that care really want people to get care about. But, you know, sometimes you got to compromise with the system that's currently in play and just kind of like fight on the daily basis, marginally increasing things for everyone. And hopefully we'll one day get to that point where the social stigmas are not as strong and we can like make bigger pushes. At least that's the way I look at it.
Yeah, I mean, one of the dentists I shadowed was uh, a franchisee of Gentle Care, so one of those like DSO organizations, and he specifically catered to. He just had a huge volume business where just every day he saw like 80 Medicaid, Medicare patients, and they had a whole bunch of FDAs to do all the basic fillings and stuff. And he was very successful doing that. But so there are probably business models that we can work within the system to still be successful. But I feel that's a exception, not the rule. Um,
Yeah.
yeah,
And
but also, yeah,
sorry, go
I was gonna
ahead.
say it's also really hard if you. I don't know. Is anyone here over the age of like 26? Okay. Um, well, just again, personal experience, but when I was like 24 to like 30, I was involved in like a startup doing like entrepreneurship stuff. And one of the things that happens when you start a business is you don't have insurance. And once you turn 26, you don't have your parents' insurance. And paying for insurance out of pocket and on the Obamacare exchange and stuff is very complicated and hard to figure out. And the coverage is terrible. And that's, again, like coming from somebody who has several degrees, and I like still every year could not figure out which insurance plan to sign up for and how to get funding and how to get find the dentist who would take whatever insurance that would change every year. It's a huge stressful thing.
Yeah, kind of like the infrastructural like obstacles, like just the straight up, yeah, like you're saying, like the layouts of websites, the layouts of forms you need to fill out, like what options do you take, like stuff that you don't even really consider, like are still like problems, even as small as that. You would think it would just be like the money for people or like the education, but like even small stuff like that is like a huge problem for people that don't know, like even like in situations like yours where you're super educated, and like even for us it would be super hard to figure out anything on like some of these websites that just have all this information going at you, and you just don't really know what to pick. So yeah, that's super interesting. And like I wanted to make one more point. I think it's probably appropriate for us to move on. We've been kind of like going on for a while, which I think is good. It's a great topic to talk about. But kind of like one thing I did want to say, which is super relevant with like COVID, like Ben's example kind of like sparked some like examples that I could think of like from working at OSU, is that from hearing from dentists also is that like between private and public practices, the the lenience that they had on who they wanted to treat, especially during COVID when they had that initial kind of shutdown, like ODA, ADA restrictions, state restrictions. I'm just like only do emergencies, like the worst of your emergencies. We need to like decrease the amount of people we have coming into these offices. Well, as those slowly started kind of easing up, the dentists had a really big leeway on what they considered in their office to be like an extreme emergency, or like once they started opening up for cosmetic surgeries or cosmetic things or just checkups, they could kind of on a person to person, dentist to dentist basis determine how far they want to go with who they want to treat. And that adds an additional problem where there's already like, at least in Ohio, 33% only receive help with Medicaid. Well, now these dentists have pretty much another reason to deny you with COVID. And of course, it's not fully the fault of dentists. It's not fully the fault of Americans of like this COVID situation. Partly it is, but there's also that like barrier and the complexities added by COVID of just, dentists trying to figure it out on their own. And, with the messaging kind of being all over the place, certain areas might just have like dentists unwilling to work for anything other than emergencies. And like in the cases where like your friend Ben had to drive super far to get treatment, or in case of Medicaid where they don't have the transportation to get somewhere else, and it just creates these kind of dead zones of like no treatment for anything other than emergencies for the people that can pay. So like it is super kind of crazy to think about like all the things that go into it, and like there's no easy way to answer any of these questions, and there's like easy solution. But like having these kind of dialogues between ourselves, future dentists, well, at least for us undergrads, hopefully future dentists, is hoping that we all get into dental school. For Shay, a little more of a real situation for him since he's already in dental school. But it's kind of like a good thing to keep in mind. Yeah. So.
I have one more question for you.
Yeah.
Do you think that if more dentists started accepting like Medicaid and Medicare, that it would be kind of worrisome that maybe the quality of treatment or care from the dentist would kind of diminish a little bit, considering like if they were getting half the price or half the amount to do a root canal from a patient that was giving them Medicaid compared to someone that had a different type of coverage. Would you be kind of worried about that the dentist just might not care as much if they were getting paid less money?
Oh yeah, I mean, when I was like had really terrible dental insurance, I went to this like super terrible clinic in Franklinton where they did not care about the patient. Like I showed up in like a suit and tie. I was like at a meeting after, like I always try and get the first meeting whenever I go to or the first appointment so I can just get in and get out. So my first appointment was at like 8, and it still took me almost 2.5 hours to get seen. They just didn't care. Like, the hygienist was terrible. The dentist barely looked in my mouth. Like, it was really rough. And so, I mean, it's understandable if you have patients that don't really care about their oral health and don't really care that you're there. And I'm sure you get really jaded over the years and just want to collect that paycheck and go home. But yeah, that is something I am worried about all the time, because I know when I was working jobs and they were not paying me very much money, I was not a great employee. And I hope I would not do that as a dentist, but maybe after 10 or 15 years of providing care, I would become jaded and not be as loving as I was when I first started the career. I don't know, but I do think that would be a problem. But yeah, if they reimburse them a little bit more, maybe they would put a little bit more love and effort into it, because there'd be more of that market opportunity, because the patient could just go somewhere else.
Yeah, I think like that's kind of looking at it, the fact that the issue of the Medicare, Medicaid like is so like it's such a hot button topic right now, and that kind of like you know, the fight for dental care kind of on the same line, especially with like COVID and everything. It's like we're kind of at that prime position right now, like for us entering dental school soon and entering the workforce soon. We're at that prime time to make those arguments to like the proper officials, ODA, ADA on like, you know what, we're willing and we really want to help like at-risk communities that are populations that need Medicare, Medicaid, but we're entering the workforce right now at like a super tough time. People are finding it hard to get access to money. At the end of the day, this would be our occupation. So we want to make enough money to pay off our debts, enter the COVID task force pretty much in like a way that we can pay for our offices, pay to kind of be involved in the system, but also not go into debt and also help the people we want to do, like we want to help. So like it comes down to us debating and arguing for, those better reimbursements. If we do increase Medicare programs in Ohio, well, what do we get from that? There has to be something that incentivizes us dentists to doing that treatment. And whether it's like one of those provisional scheduling things that you do, like Ben mentioned, of like in your office, let's say 1 week you do like 2 Medicare days and 1 week you do 0, or like every week you do 1, where like you slowly try to ease it in to where like if you work most of the week you can still make your money at good rates, find yourself in a good position to make good money, pay loans off, pay overhead off, but at the same time like provide care. It's like it's kind of like a balancing act, but I think we are like in a pretty good spot right now to make advancements, especially in dentistry. And I feel like it's probably the right time to like start arguing for these things, because I feel like now is when the spotlight's the hardest, and the room for movement on these issues is the greatest. So yeah. Does anyone else have any other questions? Because the only thing we really have left is kind of like a quick overview of the upcoming service things. But if anyone else has anything like super pressing question, go ahead. Nope. Well, feel free to reach out. As you can see, like both me and Shay, when you get us talking, we can talk for a while. Sorry about that for the people that kind of like started as a rant a little bit, but it is good to sometimes go over this info, especially if it's just like, a meeting like this is once a year or twice a year. So I'm gonna quickly share the screen again. Hang.
I'm gonna dip out. Thank you guys.
Yeah.
Yep. Feel free to reach out if, again, anything for the application journey. It's very stressful, I know, but I'm sure you will all generally do okay, and it will not be that bad. And once you get in, you'll never have to think about the DAT or anything ever again. And that will be the best feeling until you show up and you have 6 exams over 2 weeks, which is what happened to us the last 2 weeks. And it was a literal nightmare. Yeah, so thank you again. I'll talk to you all sooner or later.
Thank you for coming out tonight, Shay.
Thanks.
Thank you.
All right, so real quick, I want to make this quick since we kind of we kind of took a while today on the presentation and kind of discussion. So we kind of had that survey last time of some of these service events that you guys were very interested in or more likely to participate in. We kind of took these few top ones that we saw, and there's still the availability and the option for doing the less voted ones in the future, but for now we're going to kind of focus on the ones that you guys have most interest in. So like the Dream Center, My Family Pantry, Open Shelter were some of like the bigger ones. So our very first one, these next 3 slides, I'm just going to quickly go through these. I'm not going to describe like fully what's on the screen or read the whole thing, but our very first volunteering event is next Wednesday. Around a group of 8 people are going to be going out. That's kind of like our max number we're setting for now, since like the university still doesn't want groups of greater than 10. So that's going to be in the morning. And then there's the information here. I'm going to go through all of these 3 and kind of just give you the dates and times. And then like when we send out the meeting minutes, it'll have the information again. You can check out the address. So if you are able to drive, you'll see how far that is, what time of the day it is, if you have class during like the Wednesday one. But then the very next one after that is not this Saturday, but next Saturday. It should probably be easier to fit into people's schedules since it's a weekend. It's from 8 a.m. to 1 p.m. Usually I've gone to My Family Pantry, and I know a couple of other of you have. It doesn't usually go till 1. It kind of ends like a little after 12-ish, depending on how busy the day is. It's a super great volunteering thing. People usually have great things to say about it. So if you'd like to sign up for that, that's also going to be available. And then the third one, which is kind of a while from now, so you have some time to think about signing up for that one, which is at the Open Shelter. And that's from 9 to 12. And that's also on the weekend, so it should be a little easier to fit in the schedules. So this is our last slide. I'm just going to keep these QR codes up. This will lead you to the Google Forms if you want to sign up, especially for like the ones coming up, so the 14th and the 17th at the Dream Center in My Family. Feel free to sign up for those. We still have available slots, and if by a certain amount of time people from the club haven't signed up, we might send it to pre-dent. So if you do want to go to one of these dates, definitely recommend you do it as soon as possible, just so that when we open it up, and it probably gets filled kind of quickly, you'll have your spot if you want it. So those are those 3. And then, yeah, next meeting is Thursday, October 22nd. I want to thank you all for coming out. I know it was a little bit longer than our usual meetings, but it's a great topic. It's a great thing to get educated on. And, just speaking from some of the people that do interviews, having some knowledge on like dental related things or things kind of like hot button topics, if it comes up and you show that you're knowledgeable on it, it's definitely a plus for you. So, this is a great thing to get knowledgeable about. And yeah, that's pretty much it. I'll just keep this up for like 1 more minute. If you want to sign up, go ahead and scan it, sign up. But that's pretty much all we have for today. Thanks for coming out. Our next meeting is in 2 weeks like usual, and we'll send out the meeting minutes, and then the week of that meeting we'll send out the info for that meeting. So yeah, that's it. Thanks everyone.
Thank you.
Thank you.
All right, take care.